And thank you to Concern for inviting me to this N4G SciEd event. So my presentation will focus on investing in universal health coverage as an essential component of the European Union's multi-sector approach to nutrition. And I will share with you a couple of lessons learned from our EU action plan on nutrition. So first, I will refer to our two global commitments, which were already mentioned by Barbara. These commitments were made at international level by our development commissioner. The first one on reducing child stunting, contributing to the WHO target by reducing the number of stunted children by at least 7 million by 2025. And the second commitment made in the process of Nutrition for Growth in the first summit in 2013 in London. And it was about investing in to improve nutrition in partner countries. The pledge was 3.5 billion between 2014 and 2020. So you can see that there is a complementarity of the focus of INTPA. Investments are more on, let's say, longer perspective, reducing child malnutrition, very complementary to the ECO's action on child wasting. The EU action plan built on these two commitments and has three main strategic priorities: to enhance mobilization and political commitment for nutrition, scale up actions at country level, and strengthen knowledge and for nutrition. Our action, let's say the development cooperation investments are concentrated in 42 countries with high burden of starting and where the government prioritized investments in nutrition in the cooperation program with the European Union. We report annually within our progress reports on the advancement, on the implementation of the action plan. And the last this year report is focusing on the analysis of the progress, but also to inform the discussion, the ongoing discussion of the Commission's future role in nutrition, because it is it marks a critical juncture between two programming cycles, 2014-2020 and 2021-2027. I can share this report with you after the seminar. Maybe to mention that the programming exercise for 2021-2027 is still ongoing. And according to our preliminary analysis, nutrition could feature to varying extents in 55 multi-annual indicative programs, and mainly under the Green Deal priority, but also under sectors falling under the human development, including health. So what are the main messages from our sixth progress report? So we are happy to announce that our pledge to invest 3.5 billion was met in 2019 already, and that the total common amount of the nutrition investments between 2014 and 2020 amounted to 4.3 billion, of which 1.5 billion from humanitarian assistance, as mentioned by Barbara, and 2.8 billion from INTPA. There was also a positive progress in reducing prevalence of stunting by an average of 6.2 percentage points. and also some progress in many countries in other nutrition targets, in particular wasting, low birth weight, and exclusive breastfeeding. And regarding challenges, so this relates mainly to conflict, climate change, and the ongoing pandemic. And these also reinforce the key role of good nutrition and healthy diets for physical and mental development of children and mothers, and for enhancing their immune system function. And so very important in the context of the current pandemic. The next slide relates to, it's actually a screenshot from our sixth progress report. And just to show you that in this report, we also analyzed the lessons learned from our ongoing or concluded operations. The European Union, let's say the projects you can see on the screen relates to different geographical regions, but also to different priorities. I just mentioned it, the red to the political commitment, the blue to the scaling up delivery of nutrition, and the orange to the knowledge in nutrition. So of our particular interest is the one in Burkina Faso, which is a sectoral health budget support program implemented from 2016 to 2020. And it's an example of Commission's commitment to strengthen national health system with a focus on the integration of nutrition-related actions. I will explain the outcomes of this program a bit later, but I would first just like to share with you the general outcome of this of the analysis of these programs. And is it that what works best for improved nutrition is a locally adopted, sustained, multi-sectoral and right-based approach with a strong focus on tackling structured inequalities related to gender and related to wealth. And this is also the case in conflict-affected countries. And this multi-sectoral approach will also continue to be the main focus of the EU efforts in the next programming. So on the next slide, I would like to share with you some main features of the EU approach in supporting universal health coverage. So the EU is active in different global initiatives, and the key component is also this multi-sectoral approach. Strong emphasis is based on national ownership in terms of supporting our partner countries in identifying qualitative and necessary health services, enhancing access to these services, and taking the necessary measures to ensure that seeking quality healthcare does not result in further impoverishment. So meaning to proceed in the most sustainable way possible. It is also crucial that national institutions hold the leading role in designing and implementing reforms aimed at strengthening their health systems, and that the European Union is there to support them. So in this respect, health financing policies defined by our partner countries play a crucial role in laying down the path towards achieving the universal health coverage. In fact, these policies determine how available domestic and international resources are used to finance a given set of health services, and how payment for these services is shared between state and the population. So this is very important, the ownership of the national government. And yeah, we have this holistic approach to health system strengthening, and this involves all 6 building blocks as defined by WHO: health service delivery, workforce information systems, essential medicines, financing, leadership, and governance. On the next slide, I would like to share with you the main data on our sectoral health budget support program in Burkina Faso. The main objective is building on several years of the EU humanitarian assistance, including treatment of severe acute malnutrition. And so this budget support supported national efforts to strengthen public systems for the achievement of the universal health coverage, including nutrition services. The main achievement can be mentioned at the creation of a national budget line for the purchase of therapeutical food. So the number of children affected by severe stunting and supported by the government's therapeutical food budget line increased from 0 in 2016 to 110,000 in 2019. Also, one of the achievements of the program is indication of indicators for tracking both the quality of acute malnutrition management and the number of children in care within the health system, and ensuring annual nutrition data to reinforce government commitment and accountability at all levels. So this modality of the budget support also responds to the call for multi-annual funding and commitment from a national system to provide this perspective. It contributed to building the social contract between families and the health system, together with a political commitment required to ensure that the most vulnerable are not left behind. And to complement the answers from Barbara on the joint action or coordination between the INTPA and ECHO, I would like to mention the triple nexus between humanitarian aid, peace building, and development. So in recent years, this triple nexus has become a critical component of our partnerships, and will become even more relevant in the next programming. It is based on the principle that just a lasting peace cannot be built on foundation of hunger and malnutrition. Likewise, the eradication of hunger and malnutrition will never be achieved in the context of an armed conflict. So the main approach is to have context-specific engagement, do no harm principle, flexibility, and a conflict-sensitive approach when tackling hunger and malnutrition, and building resilient universal health coverage systems in fragile context. We have to say also that the implementing of this triple nexus approach is still in its early stages and is not without challenges. But we still need to enhance the flexibility and ability to fund rapid response, as well as development activities to enhance coordination, coherence, and complementarity between various initiatives. This is a key step. Actually, the most important is that the actors in development, humanitarian, and peace building operations are coordinated and focused on what is the best for the populations, and that local actors are also involved, provided with capacity building, and supported with resilience building activities. So I would like to thank you for your attention, and of course I'm also available to reply to some additional questions if needed.